Aloha. Welcome to the Hawaii State Center for Nursing's presentation on Native Hawaiian representation in the Hawaii nursing workforce. My name is Carrie Oliveira, and I'm the Associate Specialist for Workforce Research at the Hawaii State Center for Nursing, and I am delighted to provide this 30-minute presentation for all of you. We hope that lots of people watch this presentation for informational purposes, but we are offering continuing nursing education for this event. So before we get into the content, I have to provide some information related to our C&E materials. So the Hawaii State Center for Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The Hawaii State Center for Nursing designates this activity for a maximum of 0.5 contact hours. In order to receive credit for this activity, participants must view or listen to this presentation, complete an online evaluation form. The evaluation is available in the description of this video on YouTube below this video, and the links, the information below, as well as on the Hawaii State Center for Nursing's Continuing Nursing Education webpage. The content of this presentation was evaluated for conflicts of interest, and no conflicts were found for individuals involved in the planning or delivery of this learning activity. All participants should have read or downloaded the activity information sheet from the center's website prior to participating in this activity. The information sheet includes information about the presenters, evaluation of conflict of interest, and eligibility to receive continuing nursing contact hours. Learner outcomes anticipated for this activity: that by the end of the presentation, it's our hope that participants will be able to describe the extent to which Native Hawaiians are underrepresented at each level of nursing practice in Hawaii, and to be able to list at least one variable that contributes to the underrepresentation of Native Hawaiians in the Hawaii nursing workforce. So that's the continuing nursing education information. If you have any questions about that, please contact the Center for Nursing. Our contact information is available on our website. Prior to getting into the content, also, I do think it's important for me to note that I am not of Native Hawaiian ancestry. And so I want to be very clear about that fact, because what I'm not intending to do today, and I cannot do ever, is to talk about the lived experience of being Native Hawaiian. It is, however, my responsibility as the Center for Nursing's workforce researcher to talk about issues that the data make us aware of. And we have become aware based on our data, especially our survey data that nurses provide to us, that nurses are astoundingly underrepresented. Native Hawaiians are astoundingly underrepresented in the nursing workforce in Hawaii, and we feel like this warrants a conversation and attention. So I just want to be very clear about what I can and cannot talk about, and what I do and do not intend to talk about. That said, the presentation is going to contain three sort of like major subject areas. The first is I'm going to provide a brief, very, very brief history of the colonization of Hawaii. Then we're going to talk about the types of disparities that exist between Native Hawaiians and other groups in Hawaii, and not just in the nursing workforce, but in a variety of areas, all of which culminate and accumulate to cause or contribute to Native Hawaiian underrepresentation in nursing. And then we're going to talk about the degree and consequences of underrepresentation of Native Hawaiians in nursing. So to begin, a very brief history of the colonization of Hawaii, and I'm not an historian, and so this is mostly a list of critical events that occurred in the history of Hawaii that arguably have contributed to a system that uniquely has been designed really to disenfranchise the indigenous population of Hawaii. And so talking about history is important to help us understand what's currently happening and what the accumulated effects of that history are. So here are some major events related to colonization in Hawaii. So in 1778, Captain Cook arrives in Hawaii. You'll notice that the second date on this list, 1795, is the beginning of the Kingdom Hawaii, as agreed upon by generally most historical scholars who study the Kingdom of Hawaii. And 1795 is generally regarded as the date that Kamehameha I is credited with unifying all of the Hawaiian Islands under a single rule, monarchical rule. Prior to that, though, is when we see the first interaction of Native Hawaiians with individuals from Europe, which we could arguably talk about as the beginning of colonization, or the Native Hawaiian population with colonizers. And so Captain Cook arrives in Hawaii, a full 20 years before the kingdom is unified. So the influence of colonization in Hawaii can arguably be said to exist prior to the unification of the Hawaiian people under a single monarchy. As we know, if you remember anything, if you were local and you took Hawaiian history in school here, you'll know that Captain Cook was initially welcomed by the Native Hawaiian population. And as happens, though, with any sort of arrival of individuals from outside Hawaii, inevitably conflict arose, and Captain Cook didn't last very long in the islands, and he ultimately was met with a violent death. In the meantime, though, there was interaction between Captain Cook and his folks and the Native Hawaiian population. As happens when people from Europe, colonizers from anywhere on the planet, come to a small, isolated landmass and interact with a population that doesn't have a lot of exposure to the rest of the world, things happen that ultimately have a detrimental impact on the native population, including the spreading of disease, violent conflicts, etc. And so what we see here is the beginning of Native Hawaiians' interaction with individuals from outside of Hawaii. Really, ultimately, we can see a thread of events that had a negative impact on both the sort of robustness and the size of the Native Hawaiian population. This then feeds into a series of other historical events that have led to the systematic disenfranchisement of Native Hawaiians based on the experience of colonization. So subsequent to the formation of the Kingdom of Hawaii, in 1820, the first missionaries are reported to have landed in Hawaii. And what's important about the bringing of missionaries is we already have that initial contact with the Native Hawaiian population with colonizers from outside of Hawaii, and bringing with that the problems of colonization, violence, disease, etc. When we talk about missionaries coming to Hawaii, that introduces another set of complications. Now, I want to be very clear here. It's not my intention to disparage Christianity or Christian missionaries. There are a lot of very devout Christian Native Hawaiians who live in Hawaii today. So to be clear, I'm not disparaging Christianity. However, when we talk about missionaries bringing a religion that is different from that of the indigenous population, you don't just bring a religious ideology. You also bring a set of expectations about how a person is expected to behave. So taking one of the sort of like basic tenets of Christianity, particularly if you are a very conservative Christian, is the idea that a household is a husband and a wife, or a man more specifically and his wife, and that the female partner, the wife, is expected to be the man's helpmate. And so the man is the head of household, and he makes decisions related to how that household is run, and his wife is supposed to play a supportive role, and the primary responsibility of hers is to raise children. That ideology about the structure of the family, for instance, was brought in accompanying with religion. And so religion doesn't just come with an understanding about spirituality and God, but it talks about how human beings are supposed to relate to each other in relationships and families and households, how people are supposed to dress, what they're supposed to eat, what behaviors become sins or prohibited by the religion may or may not have been in concert with what people expected or what deemed appropriate based on the Native Hawaiian culture. So the coming together of Christian ideology with Native Hawaiian ideology, and that combination ultimately resulted in the supplanting of Native Hawaiian cultural features with colonizer Christian ideas that then sort of started to chip away at what was inherent about Native Hawaiian culture. So by this point in colonization, we have disease and conflict being brought about by colonizers, combined with a loss of certain elements, cultural elements that were replaced by what was permissible or allowable or encouraged by religion at that point. So we see a multitude of factors starting to have a negative impact on the thriving Native Hawaiian culture. So moving ahead, jumping ahead quite some time, and now we're in 1887. By this point, the Kingdom of Hawaii is interacting with a lot of other countries on the planet. There are trade agreements and treaties, and there's a very healthy trade economy happening in the Kingdom of Hawaii. But as a result of this, we've seen an increased presence in the number of people from outside Hawaii who are now living here. This then brings us to King Kalakaua signing the Bayonet Constitution. And it's a Bayonet Constitution, by the way, is an unaffectionate nickname given to a revised constitution of the Kingdom of Hawaii, which did a lot of things. But one of the critical things in terms of Native Hawaiian self-governance is that this constitution, which, by the way, King Kalakaua signed under threat of his life, which is why it was nicknamed the Bayonet Constitution, essentially removed voting rights. So it affected who was allowed to participate in democracy, which essentially said that you were only allowed to vote if you had land or if you had a certain income. So it essentially attached the ability to participate in government to either having money or having land. Now, I think if you know any Native Hawaiian ever, you'll know that the relationship that Native Hawaiians have with the land is not one of ownership, but it's about symbiosis. And the land is expected to take care of people so long as the people take care of Malamakaina, right? So taking care of the land and the land taking care of the people is a symbiotic relationship, but the prospect of ownership is not something that is part inherent to Native Hawaiian culture. So now what we have here is people who are interested in the economic and political benefits of being in charge of Hawaii deciding who gets to participate in government. And when the majority of the Native Hawaiian population doesn't own land and doesn't have the financial standing to participate in government if they don't own land, what the Bayonet Constitution essentially did is that it stripped the average ordinary Native Hawaiian from being able to participate in civic responsibility of voting, which then negatively impacted self-governance. So what that means is government now is being drawn out and carried out by people who are not Native Hawaiian. So all of the lawmaking at that point was written then to the benefit of the people who were in charge, as opposed to the Native Hawaiian population. So now what we see here is a conversion of, it's not just colonists bringing themselves and religious ideology, but now systematically altering the way that government operates in Hawaii to create systemic structures that are specifically designed to keep Native Hawaiians from participating in their own self-governance. Subsequent to that, Queen Liliuokalani takes the throne. In 1893, the overthrow of the kingdom begins. Subsequent to that, I think we all know this is like our modern history now happening. US is annexed. The US annexes Hawaii as a territory, and Hawaii becomes the 50th state. About 100 years elapsed between the initial arrival of Europeans to Hawaii and the overthrow of the Hawaiian monarchy. It took another 100 years before the United States government acknowledged that the Kingdom of Hawaii was illegally overthrown and that the people of Hawaii never actually acquiesced their sovereignty to the United States. This, I think, is really important context, because what we have here, understanding how colonization impacts the current state of Native Hawaiians in Hawaii, is really important because it talks about systemic barriers to equality and equity for Native Hawaiians. So as a result of colonization, Native Hawaiians lost their physical safety and their health by the introduction of disease and violent conflicts with the initial colonizers. There was also a loss of cultural and spiritual practice as a result of the bringing of Christianity by missionaries. And because of things like the initial signing of the Bayonet Constitution, as well as the overthrow of their government, Native Hawaiians also experienced a loss of their ability to self-govern. This creates systemic disenfranchisement. So what we have here is now the creation of a system of government and social structures that ultimately perpetuate the negative impacts of colonization on the Native Hawaiian people. Important lesson from that is that historical trauma that impacts Native Hawaiians nearly 250 years removed from initial contact with colonists is what we're dealing with today. And that trauma manifests in a variety of things today that ultimately we can pin down to contributing to an underrepresentation of Native Hawaiians in the nursing workforce here. So what exactly does that look like? So how historical trauma manifests as modern disparities ultimately, I think, is best described as sort of a vicious circle of impacts. So I'm going to start at any random place in the circle, but I'm going to start with lack of access to Native Hawaiian health professionals. So when Native Hawaiian population, who has for the last 250 years existed in a system that was constructed, engineered, designed to disenfranchise them. A lack of access to Native Hawaiian health professionals is problematic because there's a certain fundamental mistrust, I think, that exists between an individual and a system that is designed to disenfranchise that individual. If, however, you can operate within that system by being able to communicate with and contact with Native Hawaiian health practitioners who understand you culturally and also understand that you might be leery of whether or not the things that are happening in this system are ultimately to your benefit, that can cause problems. It may deter people from experiencing or accessing healthcare. It may cause non-compliance between the healthcare provider's recommendations and the individual who's supposed to be doing medical interventions for themselves for their own benefits. So there are negative consequences for not having Native Hawaiian health professionals. So, but how that happens then can be tracked back to having a variety of socioeconomic challenges as well as disproportionate negative health outcomes. And we're going to talk about these in more detail. This also leads to negative educational outcomes for Native Hawaiian students. So when Native Hawaiian students have negative health outcomes and also they're experiencing socioeconomic challenges, what we see are negative educational outcomes that impact Native Hawaiian ability to participate in post-secondary education, which is necessary to become a nurse in Hawaii. That then results in underrepresentation of Native Hawaiian students in nursing programs in the state, which then feeds back into a lack of access to Native Hawaiian health professionals for the Native Hawaiian population. So this ultimately is this spinning circle of effects. And if we break any one of these, we can change the circle and stop it from being vicious. But I think it's really important for us to understand exactly what some of these problems are so we know where to focus energy if we're going to intervene and resolve this problem. So let's first talk about what we know about Native Hawaiian representation in the Hawaii nursing workforce. So these data, the population data, come from the American Community Survey 2019. It's its most recent population estimate. And the data related to Native Hawaiian representation comes from the Hawaii State Center for Nursing's Hawaii Nursing Workforce Supply Survey, which we conducted between April and July of this year, 2021. So what you can see here is that in the statewide, the population of the state is approximately 1/4. There's decimals here, it's all rounded up. But 25% of the population identifies as being some part Native Hawaiian. So Native Hawaiian alone or Native Hawaiian in combination with one or more other races. The percentage of the population by county that is Native Hawaiian jumps up for Hawaii County. About 1/3 of the population in Hawaii County identifies as some part Native Hawaiian. The other counties are pretty close in percentage, but the sitting county in Honolulu, of course, is the lowest percentage of Native Hawaiian individuals in their population. When you look at the rows of the columns there, you see the percentage of the nursing workforce that is LPNs, RNs, and APRNs. So thinking about the data this way is that of all of the nurses who exist at each level of scope of practice, LPNs, of course, having the lowest scope of practice and cannot practice autonomously. And there are a lot of things that LPNs can't do that RNs can do, all the way up to the APRN scope of practice who are in the state of Hawaii permitted to practice independently. They could be independent practitioners. You can see that in many cases, we see a declining in the percentage of the total number of nurses who in each level of nursing practice who identify as Native Hawaiian. So we see the greatest proportion among LPNs and the lowest proportion among LPNs, but no matter which column you're looking at, you can see that there's substantially lower proportion of nurses who identify as Native Hawaiian than in the population. What this means is when you take the population of nurses and you spread them around the geography of a county, when there are proportionally too few Native Hawaiian nurses, what that does is it decreases the probability that people in that county are able to find a nurse at any level of practice that is Native Hawaiian. And again, as we talked about in the previous slide, being able to access a Native Hawaiian health practitioner, really, even if you're long-term care or if you're looking for a primary care provider, if you're looking for somebody who's Native Hawaiian, these data indicate that it makes it very difficult for people, especially in our Maui and Kauai County, to find a Native Hawaiian nurse who could be involved at any level of care. So this underrepresentation is problematic and ultimately what we would like to try to resolve. This is worse when we talk about where there is the greatest need for healthcare providers in the state. And so this focuses on underserved and shortage areas specifically for primary care. So these data come from HRSA, the Health Resource Services Administration. And again, this first graph here, the first map is just the distribution of how concentrated Native Hawaiians are in each county. You'll notice that the darkest places are where there's the greatest proportion of Native Hawaiians, and then the lighter areas where we have fewer Native Hawaiians. You'll notice the same coloring happens for these maps in medically underserved areas as well as primary care provider shortage areas. So in the places where we have the greatest concentration of Native Hawaiians, we also have the greatest shortage areas. So this is independent of whether or not healthcare providers are Native Hawaiian. This is just providers, period. So when you combine the fact that our counties that have the highest proportion of Native Hawaiian population, they have least access to healthcare providers, period. So you take that shortage of healthcare providers and you combine that with the fact that Native Hawaiians are underrepresented among those healthcare providers, the probability of a Native Hawaiian person being able to access the care that they need and that care could be provided by a Native Hawaiian person decreases substantially. And this is a problem that we are working to try to solve. So the question then becomes why? Why is it that Native Hawaiians are underrepresented in the Hawaii workforce? Solving that problem is, in order to solve the problem of underrepresentation, we have to look at the causes, the antecedent causes for why that is the case. So we can look at a variety of effects. So we can look at the socioeconomic impacts of being Native Hawaiian. So what we have is, and these data, by the way, are very recent. The citations here are on the bottom of the slides, but we have the John A. Burns School of Medicine, Department of Native Hawaiian Health Assessment and Priorities for the health and well-being of Native Hawaiians. And we also have data from the College and Career Readiness Indicators from the class of 2020. So these data are all from 2020 or 2021. So this is what the current state of Native Hawaiians in Hawaii are. So we know that Native Hawaiians are more likely than individuals of other ethnic groups to receive public assistance and homeless services. They have a highest rate of unemployment and they have lower than average annual earnings than other ethnic groups. This then paints a picture of a Native Hawaiian population that is socioeconomically unable to go out of their way to get access to healthcare, to pursue educational opportunities at post-secondary level. So not having money and being concerned about money results in having limitations of choices about how you go about your life. This also is associated with negative health outcomes, though. So what we find in the Native Hawaiian population is that we have an earlier onset and higher mortality from chronic conditions. We have a shorter life expectancy of Native Hawaiians, and they're proportionally less likely to be vaccinated for COVID-19. And as an additional statistic not on this slide, they're proportionally substantially more likely to have died of COVID-19. These things all paint a picture that impede Native Hawaiians' ability to academically achieve. When you're worried about whether you have food security or housing security, if you're ill and managing chronic conditions on a regular basis, or those chronic conditions are not well managed, this all then contributes to negative educational outcomes. So what we see in Native Hawaiian students who are graduating high school in Hawaii in 2020 is that they exhibited lower proficiency in math and reading. They had the lowest rate of on-time high school graduation, and they had the lowest rate of post-secondary enrollment. This rate of post-secondary enrollment, by the way, was substantially impacted by COVID-19. Overall, post-secondary college enrollment after graduation was down for the class of 2020, period, but the greatest losses were for the Native Hawaiian students. So if you take this picture as sort of a microcosm of adverse impacts to Native Hawaiians, you can see that between financial insecurity, negative health outcomes, those things very likely feed into reasons that our students in high school are underperforming as compared to their non-Native Hawaiian peers. When you're underperforming in high school, the chances of you getting admitted into college and then being able to pursue higher levels of education like a baccalaureate degree or the master's degree that allow a Native Hawaiian person to enter into the highest levels of nursing practice, all of these things become impossible. So in order for us to resolve the issue of Native Hawaiian underrepresentation in nursing, we have to examine these socioeconomic, health, and educational barriers, that disparities that are more likely to impact Native Hawaiians than other ethnic groups. What is optimistic about that, though, is that we have an abundance of data and that if we change anything in a vicious circle, like we remove any of the financial barriers or the health barriers, because of the nature of a circle, we change one of those things, we can change the impacts to the others. So ideally, what I think the Center for Nursing is trying to do is encourage conversation across the state in collaboration, not just with nursing or healthcare, but with our K-12 educators to figure out what can we all do as a community to figure out how to change this problem and improve the condition of Native Hawaiians so that we can see an improvement in the representation in nursing. So ultimately, what we're trying to achieve is a movement toward change. And in order to do that, I think there are 4 real important things that we have to do. Is like, first, recognize that historical trauma has tangible, measurable impacts on the Native Hawaiian population. This is a really uncomfortable realization for us to come to. Having this conversation raises hackles, I think, among people, especially in the non-Native Hawaiian community who have lived in Hawaii for a really long time. And they think to themselves, you know what, I didn't contribute to this underrepresentation of Native Hawaiians in nursing. And I am very much about, wanting to make sure equality and everybody is acknowledged. And I value the importance of Native Hawaiian culture as part of local culture. And I grew up local, and this is important to me. And it's very difficult for us to see. And I'm local, I grew up here. And so it's even difficult, it's taken me a long time to understand that being local is not the same as being Native Hawaiian, and that there are unique impacts to specifically people of Native Hawaiian ancestry as a result of that historical trauma that comes from colonization, that really we're looking at a system that was engineered to disenfranchise a people. And the acknowledgement of that reality is uncomfortable, but we have to do it in order for us to recognize that systemic change needs to be made, because the system is what causes the disparities to begin with. So we can't just talk about historical trauma as this thing in the abstract that doesn't have any real impacts, because it absolutely does, and it's data driven. I've presented the data that demonstrate that. But also for those of us who are local and think, you know what, I don't see it, or I don't experience this. It's hard. It's a hard realization for us to have. We have to get over the reality that local and Native Hawaiian are not the same thing, and that we have to improve the structures that impact specifically the indigenous population in Hawaii. Moving past the recognition of historical trauma, we also have to, I think what's really important for us to talk about solving this problem in nursing, specifically as a healthcare profession, is the philosophy of nursing, I think, really positions itself really well to be kind of the pioneer in making changes in Hawaii to improve representation of Native Hawaiians in healthcare. And the reason for that is the entire philosophy of nursing is to put a person first, right? It's really at the core, the heart of the difference between doing nursing and doing medicine is that medicine treats diseases and illnesses in people, whereas nursing cares for people with illness and disease. So the first and first philosophy of doing nursing, I think that philosophy is extrapolatable to other things. Like, we put a Native Hawaiian person first, and we identify what a Native Hawaiian person needs in order to thrive at home, at school, in an economic setting, in an educational setting, in a professional setting. And if we think about nurses as taking care of people, and we just extrapolate that same philosophy to taking care of Native Hawaiian people and providing what a Native Hawaiian person needs at every stage of their possible trajectory to a profession in nursing, we can do better when we focus on helping a single person and then creating systemic change by thinking first about people and rolling that up to a system, as opposed to trying to chip away at a system that really is not designed to change. So I think the philosophy of nursing positions it really well to be pioneers in making this change for better representing Native Hawaiians in healthcare in Hawaii, period. I think it's also an important lesson from these data that we have to intervene earlier than post-secondary nursing programs. And at this point, I really want to acknowledge the importance that a lot of our post-secondary institutions have a mission of educating Native Hawaiian people. It's either part of the institutional mission, or that schools of nursing have specifically created programs. One in particular is the Ike Aopono program at the University of Hawaii at Manoa's School of Nursing. And that one is specifically designed to provide unique and specific support to indigenous nursing students or prospective nurses. And so creating programs like this is an acknowledgement of the underrepresentation of Native Hawaiians in nursing. And so a lot of people are doing this work already in the areas that they have been able to impact. The problem, though, I think, is that the data clearly demonstrate that by the time we're creating programs and approaches at post-secondary educational institutions, college, schools of nursing, it's a little bit too late, because what you're doing is you're providing supportive services to make sure that the proportionally too few Native Hawaiian students who made it to your program to begin with have the opportunity to succeed through the end of your nursing program and then enter the nursing workforce. But those programs aren't really engineered to help people get into nursing to begin with. So really, I think what we have to do is start thinking about, how do we intervene earlier than college admission or nursing school? We have to find a way to bring nurses and the profession of nursing into K-12. Talk to elementary school students about the possibility of the profession of nursing. Help high school students who are thinking about becoming nurses or other types of healthcare professionals have access to people who are in the profession to be able to provide support and mentorship and guidance about how to succeed through like finishing high school, but also thinking about how do you write a college application, how do you get into a nursing school, which is extraordinarily, prohibitively competitive in this state. That is a whole separate webinar, but we have to start working on better representing Native Hawaiians in nursing schools before they ever get into college. So I think the data clearly identify that as a lesson. And I think that then leads to the final conclusion of this, is that we have to collaborate both within and beyond healthcare. So in Hawaii, we have a very great culture of the schools of nursing collaborating with our healthcare employers on a variety of things. And Native Hawaiian representation could be one of those things. So increasing collaboration, but leveraging these collaborative relationships to specifically address the problem of Native Hawaiian underrepresentation in nursing. There's already infrastructure to do that. We have to, though, go beyond that. Because Native Hawaiians are underrepresented in healthcare, we can't do it alone. Healthcare can't do it alone. We need to specifically go out of our way to bring in Native Hawaiian leaders, Native Hawaiian nurses, Native Hawaiian nurse leaders, people who understand mentorship of indigenous populations in any other profession, to help set up the infrastructure for us to be able to address this problem in healthcare and in nursing specifically. So I think that we do have potential and opportunity to improve this problem. It takes all of us working together in order to make it happen. And I think it requires us changing our perspective and our thinking about how we go about addressing Native Hawaiian representation in healthcare than what we've been thinking about in the past. So before in closing, I wanted to highlight this news story. It came out in August of 2020, and it was a news release that highlighted that Donna Marie Palakiko, faculty member at the University of Hawaii at Manoa's School of Nursing, was hired into its first tenure track position. She's the first Native Hawaiian person to be hired into a tenure track position at the School of Nursing. This is Hawaii's largest school of nursing. It's our flagship state UH system school of nursing. And it was a news story that they hired a Native Hawaiian person into a tenure track role. So 2 things on this note. Congratulations to Donna Marie Palakiko for being the first Native Hawaiian person to be hired into a tenure track role at the School of Nursing. And also, it is my great hope that at some point down the road, a story like this isn't newsworthy, because we've broken a system, we fixed a system that is broken. We've broken apart a broken system to make it better, so that there is a proportional representation of Native Hawaiian faculty, Native Hawaiian nurses, all throughout the entire spectrum of the nursing profession. So this, I think, heralds progress and success, and also gives me hope that eventually we don't have to have stories like this in the news, because obviously there are Native Hawaiian faculty members teaching nursing students, because that's necessary for Native Hawaiians to be better represented throughout the healthcare spectrum. That then concludes our presentation for today. I thank you so much for sticking with me and listening to everything. The PowerPoint presentation is available also as a link, either in the description of this video below or on the Center for Nursing's website. So if you don't want to listen to the video, but you want access to the source citations and the data, you can definitely download the PowerPoint presentation. If you are interested in claiming continuing nursing education credit for your participation in this activity, you will need to complete an electronic evaluation form. The evaluation will prompt you for a password. You cannot complete it without entering the password. The password is CE_45_093021. Again, if you're listening to this presentation, the password is capital C, capital E, _45_093021. If you have any challenges accessing the evaluation, please contact the Hawaii State Center for Nursing by email. We're easy to find online. And again, thank you so much for your attention and time to stay up to date on our future continuing nursing education activities. Follow us. We have a newsletter you can subscribe to. We're also on Facebook, Instagram, and Twitter. There's our handle. It's the same for every platform. Thank you so much, and we look forward to seeing you at another Hawaii State Center for Nursing continuing nursing education activity.